Welcome to today's Explainer. We've all heard it, right? Someone rubs their temples and says, oh, it's just a bad headache. Well, we are going to completely shatter that misconception right now. Migraines are complex, they're debilitating, and they require a really specific clinical approach to manage effectively. Today, we're diving into the data and clinical guidelines from University College London hospitals to look at the true physical toll of this neurological disorder and, more importantly, uncover the path forward for the people who suffer from it.
Here's our roadmap for today. We'll start with more than a headache, move on to the anatomy of an attack, and then look at the 4 tiers of treatment. After that, we'll dive into the painkiller paradox and finish up with tracking your triggers. Let's get right into it.
Section 1. More than a headache, the global burden. To really wrap our heads around this condition, we first have to look at the sheer scale of it globally. It's incredibly common, and the numbers might actually surprise you. There is a huge gender disparity here. Get this, a staggering 33% of women will experience a migraine in their lifetime, compared to about 14% of men. That is literally 1 in 3 women. Plus, the clinical data shows that if you have a family history of migraines, you're definitely more susceptible to developing them yourself.
Now, to put the just a headache myth to bed forever, consider this shocking stat. For people between the ages of 10 and 50, migraine is a top leading cause of disability worldwide. I mean, think about that age bracket for a second. Those are our most active, formative, and productive years. The toll an attack takes on your personal, social, and professional life is massive. And that's exactly why recognizing and treating this properly is so absolutely crucial.
Moving on to Section 2, the anatomy of an attack, the physical toll.
So, we know the global burden, but what does the invisible, physical reality of an attack actually look like for a patient? The pain is usually moderate to severe, but it's the sheer time burden that's just wild. A single attack can lock someone down for anywhere from 4 hours to 72 hours. That is 3 full days of intense, debilitating pain. Just imagine losing 3 days of your week to this.
But the time burden is only half the story. The physical toll goes way, way beyond head pain. You can experience any combination of these diverse symptoms during an attack. Nausea and vomiting are super common. People often become incredibly sensitive to their environment, where light, sound, certain smells, or even just shifting your weight can become agonizing. Add in neck stiffness, severe mood and sleep changes, and this dense brain fog that wrecks your concentration. It's a full-body neurological event.
And here's the kicker. It doesn't just magically end the second the throbbing stops. Oh no. A lot of folks enter a phase known as the poststrome. Think of it like a neurological hangover. You continue to experience some of those lingering symptoms, and you just feel completely drained and exhausted for days after the pain is gone. So that 72-hour window we talked about, it can stretch way further into your week.
Okay, let's talk solutions. Section 3, the 4 tiers of treatment, a path forward. Because this condition hits so hard, early and proper treatment is an absolute game changer for your quality of life. The management strategies fall into 4 main buckets: self-management strategies, acute treatments, preventative treatments, and transitional treatments. Think of these as different tools in your medical toolkit, options every patient should be discussing with their doctor. Let's break down the 2 most common medical approaches.
It is vital to understand the difference between immediate relief and long-term prevention. Acute treatments are your in-the-moment fix. You take these painkillers during an attack to manage the pain right then and there. But they aren't going to stop the next one from coming back. Preventative treatments, on the other hand, tackle the underlying cause. Now, to be clear, they aren't a magic cure, but their whole goal is to help control symptoms and reduce the severity and frequency of the attacks over time.
There's also a 4th tier you should know about: transitional or bridging treatments. These are rapid, highly specialized clinical interventions like peripheral nerve blocks. They're used when someone is in severe, immediate need and literally cannot wait for other medications to kick in. They act as a bridge to give you rapid relief during a really brutal attack.
Which brings us to Section 4, and this one is a bit of a mind-bender. The painkiller paradox, when relief backfires. This is a really counterintuitive trap that so many desperate patients fall into. When you're hurting, it is so tempting to reach for a painkiller every single day. But clinicians actually draw a very hard line. You must limit acute painkiller use to 10 days or less a month. Yep, just 10 days.
So why the strict limit? Well, if you blow past those 10 days, you can trigger something called a medication overuse headache.
Taking too many painkillers literally winds up your nervous system, causing more frequent headaches while actually making your preventative meds less effective. It's a brutal cycle. You take pills for the pain, and the pills cause more pain. Honestly, the only way to break out of it is to completely stop or drastically cut back on those painkillers.
So how do we stay on top of all this? Section 5. Tracking your triggers, the headache diary. How on earth do you keep an eye on that 10-day limit, or know if your preventatives are even working? You use a daily headache diary. It's a completely non-negotiable part of management. You simply jot down the date, how bad the headache was, how long it lasted, and, super importantly, if you used a painkiller. This specific data gives you and your clinician the hard facts. It shows exactly how often attacks are happening, how you're responding to treatments, and it keeps you safe from creeping past that 10-day danger zone.
But here is the absolute golden rule for your diary. When you're logging your pain level, you have to take those subtle, lingering symptoms seriously. You only get to write down a 0 on days when your head is 100% crystal clear. If you're in that post-Rome phase, feeling all foggy or totally wiped out, that is not a 0 day. Capturing this honestly is the only way your doctor sees the true picture of your disability.
Look, migraine is a massive, incredibly complex neurological beast. But with the right tracking and the right clinical tiers of treatment, it can absolutely be managed. So as we wrap up our explainer today, I want to leave you with this provocative question. Look back at your last 30 days. Are you reaching for painkillers on more than 10 days a month? Be honest. Because if the answer is yes, you might actually be winding up your own headaches. If that's you, starting a headache diary and having a chat with your doctor needs to be your very next step.